Bismillahirrahmanirrahim. Assalamu alaikum. So today we are going to study about one of the most important topic of vascular pathology, and this topic is known as atherosclerosis. So what is the meaning of atherosclerosis? So atherosclerosis consists of two words, the athero and the sclerosis. Athero means atheroma, and what is atheroma we will discuss in detail about this later. And the sclerosis mean hardening. So in this, the hardening and thickening of the vascular arteries occurs. Hardening and thickening of the vascular arteries occurs. So let's discuss the definition of atherosclerosis. What is atherosclerosis? So it can be defined as the thickening and hardening, as I have already discussed, thickening and hardening of the large and medium-sized muscular arteries. The large and medium-sized muscular arteries are the most common arteries involved, and this is mainly due to the involvement of the tunica intima, although the tunica media can also be involved, but is mainly due to the involvement of the tunica intima, and is characterized by the fibrofatty plaques or the atheroma, as I have already discussed atheroma. And this atheroma or fibrofatty plaques can obstruct the blood flow, resulting in the ischemia. So for example, this is the large or medium sized artery. It consists of, every artery wall consists of three layers: the adventitia, the first one, the second one is the media, and the third one is the intima. So this atherosclerosis is mainly due to the involvement of the intima layer. So it is characterized by the formation of fibrofatty plaques. So in the intima, here is the fibrofatty plaques or the atheroma forms. This is the atheroma or fibrofatty plaques, and this fibrofatty plaques can reduce the diameter of the vessel and can obstruct the blood flow, as we have already discussed. This is the blood flow, and this atheroma can obstruct its flow. Now, what are the most common arteries which are affected by the atherosclerosis? So, in descending order of severity, atherosclerosis involves the infrarenal abdominal aorta. It is the most common aorta in which the atherosclerosis occurs, followed by the coronary arteries, then the popliteal arteries, then the internal carotid arteries, and the vessels of the circle of Willis. So these are the most common arteries in which the atherosclerotic plaque formation occurs, and this is in descending order of severity. Descending order of severity. Now, what caused the formation of atherosclerosis? What caused the formation of atheroma, atherosclerotic plaque, or what is the etiology behind atherosclerosis? So there are two kind of causes or factors which can cause this atherosclerosis. The first one is the non-modifiable, which are also known as constitutional, and the second one are the modifiable. And what are the modifiable? It means that they can be changed by lifestyle or therapy, and the non-modifiable, i.e. non-changeable, cannot be changed by the lifestyle, by the change in lifestyle or by the therapy. So first, talking about the non-modifiable or the constitutional causes or factors. So the first one is the genetic abnormalities. For example, certain Mendelian disorders like the familial hypercholesterolemia are much more associated with the atherosclerosis. So a person which have a genetic problem like hypercholesterolemia have a much more chances of becoming atherosclerotic. The second one is the family history. So a positive family history have a much more chances of formation of atherosclerotic plaque in the descendants. Third one is the increasing age. The formation of atherosclerotic is much more at the age of about 50 to 70 years, and it increases with the age. The third one is the male gender. لا لا نخرم لا بص لا نخرم اختصم منه ده بص كلمة درانك بس لك درانك بس. The fourth one is the male gender, So the male gender are much more at risk of becoming atherosclerotic, and this is due to the presence of estrogen in women. Estrogen have a protective role against the atherosclerotic. So the post-menopausal women are also at a much more risk of becoming atherosclerotic, and this is due to the decrease in the estrogen level after the menopause. After the menopause. Now coming towards the modifiable factors, we have already discussed that the etiology of atherosclerosis is divided into non-modifiable and modifiable. So now talking about the modifiable vectors, so the first one is the dyslipidemia, and specifically the hypercholesterolemia or the high LDL level in the blood are much more associated with the atherosclerotic. So as we already discussed, it is modifiable. So how to modify or change dyslipidemia? So avoiding the saturated fats like which are present in the egg yolks, animal fats, and butter, and the trans unsaturated fats, for example, which are used in the baked goods and the margarine. So they can decrease the cholesterol level in the blood. And by taking the polyunsaturated fats and the omega-3 fatty acids which are present in the fish oils, they can also decrease the level of cholesterol in the blood, and thus they can decrease the chances of atherosclerosis. Statin, which are drugs, can also decrease the cholesterol level in the blood, and they can be taken on the prescription of your doctors. Also, the high LDL level in the blood can also decrease the risk of atherosclerosis. So doing exercise can raise the level of HDL in the blood, whereas obesity and smoking can decrease the level of HDL and increasing the chances of becoming atherosclerotic. So this is the first modifiable cause of atherosclerosis. The second one is the hypertension, and this hypertension can increase the risk of ischemic heart disease by about 60%. The third one is the cigarette smoking. The fourth one is the diabetes mellitus, and this is because in diabetes mellitus there is much more level of cholesterol in the blood, i.e. there is hypercholesterolemia, and we have already discussed in the section of dyslipidemia that hypercholesterolemia can increase the chances of becoming atherosclerotic. Now there are also some additional risk factors which increase the chances of becoming atherosclerotic. So the first one is the chronic inflammation, because the inflammatory cells have a role in the formation, progression, and the rupture of the atheromatous plaque or the atheroma. So chronic inflammation can increase the chance of becoming atherosclerotic. The second one is the hyperhomocystinemia. Increased level of homocysteine, which is an amino acid in the blood, can also increase the chances of becoming atherosclerotic, and this is because the high level of homocysteine can injure the endothelium, and it can also cause the increased clot formation in the blood. The third one is the homocystinuria. Homocystinuria in the sense that if there is homocystinuria, then automatically there will be much more level of homocysteine in the blood, and as I have already discussed, this homocysteine can damage the endothelium and increase the chance of becoming atherosclerotic. The third one is the metabolic syndrome, which is mainly characterized by the obesity, insulin resistance, and other metabolic problems. Those which have metabolic syndrome are much more prone to become atherosclerotic. The fifth one and the sixth one are increased level of lipoprotein A or the apolipoprotein. They also increase the risk of atherosclerosis. The seventh one is elevated level of procoagulants. If there are much more level of procoagulants in the blood, then they increase the chances of formation of atheroma, because it increase the formation of thrombus. Increase the formation of thrombus. So the eighth one is the clonal hematopoiesis. But the reason or the mechanism behind that, how this clonal hematopoiesis can result in the formation of atherosclerotic plaque or atheroma, is unknown, and the study are in progress to know the cause of clonal hematopoiesis in the formation of plaque. The ninth one is the lack of exercise or living a competitive, stressful lifestyle, which is also known as type A personality. This type A personality also increases the chance of becoming atherosclerotic.